Assalamualaikum warahmatullahi wabarakatuh. My name is Dina Farna binti Zainuddin. So today I'll be representing group PBL 11 and 12 to talk about background on stem cell therapy. Okay, so what is stem cell therapy? Stem cell therapy, also known as regenerative medicine, it promotes the repair response of disease, dysfunctional or injured tissue using stem cells or their derivatives. There are many uses of stem cell therapy, such as it grows new cells to replace damaged organ or tissue. It corrects part of organ that do not work properly. It is used to research causes of genetic defect in cells, to research how disease occur and why certain cells develop into cancer. And then it is used to test new drugs for safety and effectiveness. There are three types of stem cell. The first one is embryonic stem cell. Second one is adult stem cell. The third one is perinatal stem cell. In embryonic stem cell, the cell is taken from the 3 to 5 days old embryo. Embryonic stem cell is pluripotent, which can divide into more stem cells in the body or can become any type of cell in body. In adult stem cell, the cell is taken from developed organ and tissue in body, such as bone marrow and fat. Adult stem cells have more limited ability to give rise to various cells of the body. In perinatal stem cell, the cell is in amniotic fluid as well as umbilical cord. There are 6 stages of stem cell therapy. First one is stem cells move from bone marrow to bloodstream using chemotherapy and synthetic growth factor. The second one is machine collects blood and separate out stem cells. Third is stem cells frozen ready to return to body later. The fourth one is more chemotherapy used to fully or partially wipe out bone marrow and immune system. Next, stem cells return to body using a drip. The last one is body recovers over a period of 3 to 6 months, sometimes longer.
Which diseases can be treated with stem cell therapy? One of them is Parkinson's disease. PD, or short for Parkinson's disease, is a neurological disorder that is due to the degeneration of dopamine neurons in pars compacta, which will increase the overall excitatory drive in basal ganglia, disrupting the voluntary motor and causing characteristic symptoms of PD such as tremor, shaking, slow movements, and the loss of automatic movements such as blinking and swinging of the arms and walking. By stem cell therapy, new dopamine cells will be introduced into the brain, and it will help to replace what is lost in PD and reduce the symptoms. Stem cell therapy is conducted by isolating the stem cells from the patient's brain. Then, the stem cells will be cultured in vitro and are encouraged to turn into dopamine-producing neurons. As soon as tests shows that these modified stem cells are producing dopamine, they will then be re-injected into the patient's brain. As a result of stem cell therapy, the patient's condition will be improved and there will be reduction in trembling and muscle rigidity that is associated with this disease. Stem cell therapy is also used in cancer treatment. Stem cell transplants are procedures that restores the blood-forming stem cells in people who have had theirs destroyed by the very high doses of chemotherapy or radiation therapy that are used to treat certain cancers. In a stem cell transplant, the patients will receive healthy blood-forming stem cells through a needle in their veins. Once the stem cells enter their bloodstream, the stem cells will travel to the bone marrow, where they will take the place of cells that were destroyed by the treatment. The blood-forming stem cells that are used in the transplants can come from the bone marrow, bloodstream, and the umbilical cord. Stem cell transplants are most often used to help people with blood cancers, such as leukemia, which is a disorder with increased number of abnormal leukocytes, and lymphoma, cancers that arises from lymphocytes. They may also be used for neuroblastoma, cancers of immature nerve cells, and multiple myeloma, cancers that forms in plasma cells. In theory, there's no limit to the types of diseases that could be treated with stem cell research. Given that researchers may be able to study all cell types that are present in the body, they have the potential to make breakthroughs in any diseases. In this slide, it is shown the examples of diseases or disorders that can be treated with stem cell therapy. Examples that is shown here are blood cancers, as have been mentioned before, solid tumors, non-malignant blood disorders, immune disorders, and also metabolic disorders.
Stem cell therapy can be classified into two, based on potency and based on origin. Based on potency consists of totipotent, pluripotent, and multipotent. Based on origin consists of embryonic stem cell, gestational stem cell, adult somatic stem cell, and induced pluripotent stem cell. Cell potency can be divided into totipotent, pluripotent, and multipotent. Totipotent is the cell ability to divide and differentiate into cells of the whole organism. It has the highest differentiation potential and allows a cell to form both embryo and extra-embryonic structures. For example, a zygote, which is formed after a sperm fertilizes an egg. These cells can later develop either into any of the three germ layers or form a placenta. After approximately 4 days, the blastocyst in the cell mass becomes pluripotent. Pluripotent, able to give rise to all various cell types of the body. It cannot make extra embryonic tissues such as the amnion, chorion, and other components of the placenta. For example, embryonic stem cells, which are derived from the inner cell mass of pre-implantation embryos, and induced pluripotent stem cells, derived from the epiblast layer of implanted embryos. One of the methods to assess this activity and spectrum is the teratoma formation assay. Multipotent. Multipotent have a narrower spectrum of differentiation than pluripotent stem cells, but they can specialize in discrete cells of specific cell lineage. For example, hematopoietic stem cell, which can develop into several types of blood cells. After differentiation, a hematopoietic stem cell becomes an oligopotent cell. Its differentiation abilities are then restricted to cells of its lineage. However, some multipotent cells are capable of conversion into unrelated cell types, which suggests naming them pluripotent cells. Stem cell therapy based on origin consists of embryonic stem cell, gestational stem cell, adult somatic stem cell, and induced pluripotent stem cell. Embryonic stem cells come from human embryos that are 3 to 5 days old. It derives from the inner cell mass of blastocysts created by in vitro fertilization or from abortions. This involves fertilizing an embryo in a laboratory instead of inside the female body. Embryonic stem cells are pluripotent and have the ability to replicate indefinitely. Secondly, gestational stem cells. Cell types with therapeutic potential can be derived from gestational tissues, including the placenta, umbilical cord, and the amnion. It poses no ethical threat since they do not require invasive medical procedures and the tissues are usually discarded following birth. Gestational stem cells have the properties of both embryonic stem cells and adult stem cells. It maintains the ability to differentiate and also grow rapidly when cultured. It naturally immunosuppress and do not face the potential of rejection like embryonic stem cells. One of the examples of gestational tissues used in gestational stem cell therapy is placenta mesenchymal stem cell. Placenta mesenchymal stem cell being less exposed to infections as they come from an infection-naive environment which render them less likely to transmit disease. Secondly, amniotic fluid stem cell. Amniotic fluid stem cell can be get from the umbilical cord or placenta of newborn baby. It contains blood stem cells and cells will be cryopreserved in cell banks. It used to treat children with cancerous and genetic blood disorders and less likely to be rejected by immune systems. Next, adult somatic stem cell. Adult somatic stem cells are any stem cells taken from the mature tissue and found in the tissues of a fully developed child or adult and can only produce a limited number of cell types. They play a vital role in tissue repair, regeneration, and are referred to their tissue origin. There are 4 types of stem cells under adult stem cell, which are hematopoietic stem cells, mesenchymal stem cells, umbilical cord stem cells, and skin stem cells. Hematopoietic stem cell is the first stem cells to be identified and reside in bone marrow and cells in the blood. It used to replace a patient's blood disease such as leukemia and anemia by bone marrow transplants. Secondly, mesenchymal stem cells. Mesenchymal stem cells are multipotent stem cells that can differentiate in vitro or in vivo into osteoblasts, chondrocytes, myocytes, and adipocytes. It has potential effect on immune response in the body to reduce inflammation to help treat transplant rejection. However, no treatments using mesenchymal stem cells are proven to be effective. Third, umbilical cord stem cell, which is same as amniotic fluid stem cell in the gestational stem cells. And fourth, skin stem cell, which used to grow new skin in the lab for burn patients, especially third-degree burns, but the new skin doesn't have any glands and hair follicles. Lastly, induced pluripotent stem cells. Somatic cells reprogram to enter an embryonic stem cell-like state by being forced to express genes and factors important for maintaining the properties of embryonic stem cells. It can differentiate into all types of specialized cells in the body and potentially produce new cells for any organ or tissue.
This is the last part of stem cell therapy presentation, which is the application of stem cell therapy. So first is for central nervous system repair in spinal cord injury. There's many kind of stem cells being explored for treating spinal cord injury, but mostly they involve a similar strategy, which is to inject stem cells into spine. So the cells which is injected into spine will reach the area of injury and differentiate into peripheral neurons, which will spontaneously repair the damaged circuits. So 2 out of 4 patients treated showed improvements in both motor and sensory function, and none had any adverse effect after 2 years. The second application for stem cell therapy is to restore immunity after chemotherapy. So for cancer, mostly we use chemotherapy for the treatment, and it involves the use of intracellular poison targeting the cell division. This will kill all the cells in the body which had highly undergone mitosis, including the cells that are needed in our body. So the killing of the cells will lead to dangerous side effects such as immunosuppression, and the high dose of chemotherapy will alter the bone marrow stem cell population, which usually it will eliminate the white and red blood cells production. So to manage this problem, there will be bone marrow replacement by transplanting healthy cells. So we can either graft the patient's own bone marrow or from a donor with appropriate immunologic characteristics so that the patient immune system can regenerate after being eliminated by chemotherapy. The third application is to alleviate macular degeneration. Among many causes of blindness, age-related macular degeneration is the most common cause of vision loss in people over 50. So in this disease, there is onset of cell death in macula. Macula is the area which corresponds to the vision field center. And if there is atrophy of the macula, it can result in clouding of vision and eventually complete loss of sight. So to tackle this issue using stem cell, one of the strategies is to focus on the RPE cells or retinal pigment epithelium cells. These cells function to provide nutrients and remove waste for photoreceptor cells. As the disease progresses, there will be thinning of RPE layer, which lead to vascularization and death of photoreceptors. So RPE cells is produced in vitro from stem cells and injected into the retina. So from this treatment, although patients will fall from retrieving their lost sight, they can have slight improvements which greatly alleviate quality of life issues and possibly prevent further degeneration of the tissue. This marks the end of the presentation of stem cell therapy. Here's a list of references used for this presentation. That's all from us. Thank you for listening and have a great day.